Hey guys, so I'm here in my treatment room. I'm about to do the new Total Skin treatment by Lutronic on my own skin. I've prepped my skin by numbing with the lidocaine tetracaine cream and sanitizing with a little bit of alcohol. So you can see I'm a little bit pink and red, but that's totally normal when you are using prescription strength numbing and alcohol to prep the skin. What I did even before that is I applied a 35% TCA peel into individual acne scars. That is called TCA Cross, and it's a really great treatment combined with other modalities to help with acne scarring. Or if these other modalities are too expensive for you, this is also a great affordable treatment for acne scarring that can be done on all skin types as long as your skin is prepped properly. So I'll talk more about TCA Cross separately in another video, but I wanted to just share a quick little bit about it with you guys before I start my total skin treatment. So I did the TCA Cross before, and then I'm going to do the Genius radio frequency microneedling followed by the Ultra laser resurfacing. All right, so here's the Genius RF microneedling by Lutronic. Has little gold-plated needles. I'm gonna start on my forehead first and around the eyes because that's generally the area that's a little bit more uncomfortable. It's more bony. So I'm gonna start there first. With the numbing cream, honestly, I can barely feel anything. These needles are so fine, which is why I love the Genius. And one of the special things about Genius is that it has impedance control, which makes sure that every pulse that's firing is 100% accurate as it goes in and out of the skin. So it allows for a more effective and safer treatment. The other thing I love about Genius is that the device shows the exact amount of energy you're putting into the skin and also the total amount of joules, which is the type of energy that we are using. Okay, so I am gonna go around my eyes now. My eye area, I am gonna do a 1 millimeter setting, which is deep enough to treat the eye without going too deep. The eye area, you really don't want to go past 1 millimeter. It's thin skin, and it's just not necessary to go past 1 millimeter. During the treatment, we'll do about 2 to 3 passes depending on how each person is responding. We just look for that redness and erythema, which is our clinical endpoint. With this, you don't get a lot of pinpoint bleeding, and that's also why the skin heals super quick. It's a lot less traumatizing than regular microneedling. All right, so I kind of have done the whole upper half of my face, and now I'm gonna work down here and also the neck area. So I'm gonna do at a deeper setting than I would for the upper part of my face. All right, so I've finished my entire face. Now I'm gonna work under the jaw and on the neck. This area we'll typically do between 2 and 2.5 millimeters. And if someone is wanting to melt some of the fat around their chin, if they have a double chin, we will do anywhere between 2.5 and 3.5 to get to that layer that holds the fat. But typically when we say under 2 millimeters, anywhere on the neck, under the chin, jawline, face, you are not gonna affect fat in the face unless you are going past 2 millimeters, depending on what the area is, no matter what device you are using, because I know a lot of people had questions about that. So, all right, so I am just finishing up my neck here. Like I said, make sure you take care of your neck and your chest. Those are gonna show the signs of aging even before the face. So it's really important that when you come in, you take care of these areas. RF microneedling can also be done on the hands. It can be done on areas of the body that have loose skin and excess fat, stretch marks, surgical scars. So there's a lot of uses for radio frequency microneedling. So if you have any questions, make sure to leave me a comment below. On a roller system, it's spicy, but I would actually say the microneedling portion of the treatment, because there's needles and heat, is a little bit spicier. The laser moves over the skin very quickly, so it's actually not bad at all. And this is very similar to Fraxel. It's very similar to Moxie. A lot of these lasers do the same thing. They are just different brands. Okay? All right, I'm almost done. I'm going to just finish off with my neck here. The neck is typically the most comfortable part of the treatment. Not as many nerves, so not as many pain receptors in the neck. All right, so here's my skin after the total skin treatment. Nice and pink and stimulated. That's exactly what we want. Feels a little like a sunburn. The heat goes away in anywhere from 30 minutes, 60 minutes, maybe up to 2 hours if your skin is more sensitive. And now for the best part is the exosomes post-treatment. These are even more concentrated in growth factors, vitamins, nutrients, regenerative properties than PRP, and you do not have to get your blood drawn for these. You can add these on to any microneedling laser or total skin treatment. So if you're curious about them, you can ask me about it at your next appointment, and I will probably mention it to you because these are brand new. I have the 2 vials here. We have the exosome complex, which comes in a powder, and then we have the diluent, which is a hydrating serum liquid diluent that we mix into the exosomes to activate it, and then we're gonna shake it up. So if you guys were using these at home for your treatments, this is exactly how you would do it. If you wanna order these, please send me a DM, email, or text message, and we can ship them to you overnight, and you can use them for your treatments or even at home. So I like to shake it up for about 15 to 20 seconds to make sure it's all mixed together there. You wanna just make sure you don't see any powder. And typically I get like 2 uses out of the vial. You do not need to use a syringe. I apply a little bit to my hand, and then I apply it directly to the skin. It feels so nice post-treatment. You might be able to, if you're just using it on the face, you might be able to get like 3 uses out of it. I typically get about 2 when I'm doing the face and the neck. It depends how much you're using too. You don't need to use a lot, but you just want to make sure you're getting a nice layer everywhere. So I really like to massage it in, and then we'll put some on the neck. Of course, I forgot to take before photos, so I'm sorry about that. I will try to at least take some after photos and document the progress and the healing. Let's see how much I have left. So yeah, I probably have about 2 uses left out of this. I'm actually gonna just apply a little bit more. All those channels are open, so we really wanna make sure we get a lot of the exosomes in there now. So I like to use the vial up within a 24 to 48 hour period. So if you're using it for a treatment, we typically apply about half the vial during your appointment, and you'll go home with the other half that you can use that evening or the following morning. Once it's open, you just want to make sure you're keeping it in the refrigerator, so you can just pop the little top back on and keep it right in there, and it'll help it stay fresh. So that's the complete total skin treatment with the exosomes. Again, total skin addresses all the different layers of the skin in one treatment. The radiofrequency microneedling is working in the dermis. It can also work on the epidermis with more shallow settings, but we really want it to go into that dermal layer to stimulate the collagen, to help tighten the skin, to help with acne scarring, pores, and texture, as well as just overall rejuvenation and giving you that boost of collagen to keep your skin youthful long term. So this can address so many different concerns, especially when you combine it with the Lutronic Ultra 1927 nanometer laser for the total skin treatment. This is going to work more epidermally to remove pigmentation, to help with pores, texture, tone, giving you that nice glassy, glowy, rejuvenated skin, and it's also going to give you a boost of collagen. So this is hands down my favorite treatment, and since we've been combining it with the exosomes, we're seeing even better results and even quicker healing times than with just your typical growth factor or PRP. So if you have questions about total skin, leave me a comment below, send me a DM, give us a call, email me, whatever works for you. I hope you found this helpful, but if you have questions, please leave me a comment. Engage with the video. I hope you enjoyed it, and I'll be back on here to share some more treatments with you soon.